There's been a lot of discussion on making the correct diagnosis of a painful shoulder. And an area of concern for abuse is the consideration for a possible tear of the glenoid labrum. The labrum is within the shoulder. It's like a retaining wall of fibroelastic tissue around the glenoid. The glenoid is the ball in the socket. The ball and the glenoid would be the socket, but the ball is much bigger than the socket. And so the retaining wall around it helps maintain its stability. It turns out that almost anyone who's actually torn the labrum has either dislocated their shoulder or is a professional or semi-pro baseball pitcher. Glenoid labral tears are very rare, and there are degenerative lesions of the labrum that can occur, and they're very common. They don't usually bother people, but we'll treat them if we encounter them just to make sure there's no contribution to the overall problem. It turns out that if we do diagnose a labral tear, it's generally going to be intraoperatively. The MRI scan is notorious for over-diagnosing this. There's a lot of genetic variation in where the labrum attaches to the glenoids, and so some of the natural occurring variations are misdiagnoses of torn labrum. And Dr. Weber, a professor at UC Davis, has lectured on this and proved this point as well. But it turns out that if you do operate on a torn labrum, the results are generally terrible. 40% of professional athletes that have had a glenoid labral tear get a decent result. The other 60% fail and are not playing ball anymore. So the recommendation now, if somebody actually has a torn labrum and they're 40 years or older, is to just cut the biceps tendon because it tugs on the labrum and causes pain, and just releasing the biceps gets rid of the tugging and the pain. The person who's been told they have a torn labrum usually has the wrong diagnosis, whether it's with a physical exam or an unnecessary MRI scan. The majority of people who have shoulder pain have it because of irritation of the rotator cuff and or the biceps tendon. The treatment for that is actually very successful. Impingement syndrome, or bone rubbing on the rotator cuff and or biceps tendon, accounts for the majority of pain in the shoulders. It's from the front and to the sides.